What's up, everybody? This is the Daily Dose of Mental Health, and this is another update video. Haven't done a video in a while. Just been busy, and I don't know. Lately, just had some rough times and whatnot, but getting back on the grind horse. Gonna try to stick to doing 1 to 2 videos a week still. So yeah, if you like this content, please like and subscribe. I'm still waiting to buy some more editing equipment for my channel. But that's going to have to wait until I do find a new job, which I'm currently still seeking. Staying confident though. So in this video, essentially what I'm wanting to talk about is I've seen a lot of ramblings, not ramblings, but a lot of discussion, not ramblings, on the current crisis we are in. And I'm not talking about the COVID pandemic. That's not what I'm discussing. I'm talking about the mental health pandemic we are in. The reason I bring this up because in the last month or two, and this might be why I've been kind of down lately and why I haven't made many videos, but it's something that I want to get off my chest, is we have seen an uptick in so many freaking drug overdoses, in particular heroin, stuff being laced with fentanyl and stuff now. It's sad. It's really sad. And I really do think that one harsh effect in the next couple of years we're really going to start seeing, which we are already, is what's going on currently. A lot more overdosing, relapsing, and just mental health problems in general. And why I'm putting this video out is because if you need to get help, even if you don't have the money to, if you don't have a job right now, there's help out there for you. Free help. That's partly what I'm trying to provide in this channel. I'm an ex-addict myself. Well, currently, I consider myself always in recovery, a recovering addict, always an addict, but a recovering addict. You know, and one thing I look back on in particular with my pill addictions, which is still a daily battle, and I haven't relapsed on that. I've just had a lot more, I'm not going to lie, a lot more mood swings, depression, just tough times during this. There is value in seeking help if you are ready to seek help. Meaning, you can have people around you telling you, please get help, trying to provide you with resources, wanting you to get clean if that's what it is, wanting you to get help for your depression or anxiety. But one thing I do tell patients as well that are there, that I've seen in my past, and patient families, that, in particular, patient families in general, I'm an RN, that you can try to provide as much help as you can. You're only there trying to help. But there's going to be a fine line crossing to where that switch in the addict or the person with mental health problems, that switch has to flip for them. And that's sometimes what they talk about, being in that lowest of lows. For me, for addiction, you have to be at your all-time low where you just say, screw it, I'm done with it. Sometimes some people find recovery earlier than others, and at a point where it doesn't affect their lives near as much. Some people find recovery if they're put in jail, if they're arrested. I know a couple people who were out there slinging dope left and right. Flocko was a big thing for a while. Heroin. And they got busted, and honestly, I'm talking to them to this day, they say the best thing that happened to them was getting arrested and going to jail. Granted, they got felonies out of it, but what came out of it was going to jail for a year and a half, and they got clean there. So the idea of, if you have a loved one, I'm talking to the addict / the person suffering, and the immediate ones around them experiencing somebody suffering from mental health or addiction issues. So this is going to be going to both sides of the coin, but sometimes that's why, in my opinion, the prison system, it has its own set of issues. But I have numerous friends who their low was going to jail, and that got them clean. It was hell at first. Don't get me wrong, the first 3 or 4 months for them sucked. It was straight hell. Straight hell. But once they got past that barrier, they realized how effective it actually was going to jail. And that's the example of the lowest of the low. The next example I'm going to throw out would be something like mine through my own experiences. And this is the vast majority of people that I'm trying to hit, that if you recognize you possibly have an issue with something, a drug, if you feel like you have a problem with anxiety or depression, that's the first step in actually the recovery process. And I know that might be like, whoa, well, I've been through that many times where I know I need to quit, and then I end up relapsing, or, oh, I know I need to get help for my mental health disorder, but then I just go back to it. Well, guess what? That's how I was too, and eventually it did come. But if you also know somebody out there who is doesn't want help with whatever's going on, that you've got to realize there's a certain point where you just need to give them their space and let them find it for themselves. And I know sometimes it's like you feel like you might not be doing enough for the loved one, but at the end of the day with it, especially if they're an adult, if it's somebody below 18 that's living in your house, that's a different scenario. But if it's somebody that's an adult and they're just not seeking help, you're just going to have to let them fall, unfortunately, because there are very few actually instances that I actually am aware of where, I've had people come into the psych hospital, somebody brought them in, oh, they need help, but they don't want help themselves, and then they end up going back out there, falling even harder on the ground, harder into drugs, and it can be even worse. So yes, what I'm saying is if you want, on this side, if you're a loved one wanting someone to get help, if you're wanting your loved one to get help, sorry, tongue twisted a little bit, provide them resources and let them make that decision from there if they are an adult. And then to the addict themselves, just the idea of recognizing that you have an issue is the first step. If you slip in the process, meaning I'll go to the drug addict side, if you recognize you have a problem and you try to quit and it doesn't work the first time, or you fall on your face and you relapse, don't give up from there. Don't go down. Don't keep going lower and lower. Just because you have a slip, a drug slip of whatever, acknowledge what happened, acknowledge it, and from there, move past it. We're human. We make mistakes. We're going to have problems going on in life, but the point is, if you're going down that rabbit hole to where you've been clean, but you've possibly messed up during this pandemic or whatnot, recognize it. If you lost your job because of something, and let's say you had a job, you were clean for a while, because this is what I've been hearing a lot of. Now keep in mind, I'm in the same boat. If I don't have a job right now, haven't slipped, but I'm actively trying to find one. If you lost your job and you slipped using drugs and whatnot, recognize it. Okay, if you lost your job for whatever reason, seek help if you need it, or just keep pushing forward. Those lows, you got to remember, those lows go as far as you may want them to go. Meaning, if you don't have a job and you're using, don't go lower than that. Don't go lower than that. Do what you have to do to survive, and go up. Push forward. That's kind of my first talking point I wanted to discuss, was just realize you're not alone. We are all in this together. We all have hard days, but don't keep going down that rabbit hole. And to the loved ones out there who want their loved ones to get help, provide the resources, but establish a boundary with them. If they don't want help, I know it's hard to say, but if you keep pushing on them, sometimes it can make it worse. My second point to this is, and I'll just put this out here for myself, it's kind of hard to word what I want to say, but we as a society currently need to be lifting each other up regardless of race. If you're white, black, Latino, Mexican, Chinese, Japanese, regardless of the race, we all during this time we need to help each other. We need to stick out. We need to stick up for each other, because I'll drive down the road when I'm going to the gym or whatnot on my day, and I'm fortunate while I don't have a job that I do have a car and I have a little bit of savings I had before I left my past job, which I don't want to get into, but I didn't get fired. I left that one on my own. But there's people out there that are homeless that are suffering. And what I mean by this is there's people that choose to be, there's a difference between people who choose to be homeless and those who you are going to start seeing. You're going to start seeing this summer, a year past this pandemic we're in, you're going to start seeing in the suburbs and in places where there are already homeless people, you're going to start seeing a lot more homeless this summer. I'm just going to tell you that right now. The effects of this pandemic go farther than the disease or virus itself. But anytime you can, all I'm saying is if you have an extra dollar, and once again, recognize if it's a safe scenario, but the next time you see someone and you can tell they're suffering, I'm not saying give them a ride or anything, but ask them, hey, is there anything I can do for you? And if it's, give them $1, granted they might go use it to go buy some dope, you got to realize that could be that last dollar they're using to get clean off the dope. They could be going through some withdrawals and they need this hit to go, do whatever. And I know that sounds crazy to somebody who's never used drugs before, but to those of you out there, and I know there are those people out there that, sometimes it just takes that last hit to get clean. And I know that's, once again, sounds crazy, but you never know for some people when that last hit will be, metaphorically and physically. But just be on the lookout this summer, because all I know is the one thing I can tell you that everyone can improve on is that golden rule, which is treat others as you would want to be treated. If you see trash on the ground outside, pick it up, throw it away. Or, it's just, I've noticed the idea of karma and the golden rule together can really make a vast difference on your own life and good karma coming your way and somebody else's. I guess that's what this video is. It's kind of everywhere, but I just want to let you know, to everyone out there that watches my videos, I'm doing good. I'm hanging in there. Let's keep it rolling. I've told everyone out there, this channel I'll do, it's kind of a recovery. It's the daily dose of mental health. So it's going to focus, when I think of mental health, for me, what it will revolve around is anxiety, depression, mental health disorders, and drug and substance abuse disorders, which I had, still work on to this day. Comment below what you think about what's going on currently out there. With the exception, I really don't want any, I'll say this, let's try to avoid the political spectrum. I know everyone has their own beliefs and what's going on, which is cool, but let's keep this on a basic principle of that we're all humans and stuff that'll help humans in general. But yeah, I'm doing good. Throw a comment down there on what you think's going on, how you're doing in your recovery, or whatever's going on with you. Just know I'm doing okay. I'm gonna post videos as much as I can. I love you all. Peace and love. And let's have a rest of the good week. I'll keep everyone updated when I have another job interview or I have a job coming. Haven't heard really anything yet, but I'm going. I'm keeping my head up high. And let's rock it. Let's get after it. And let's just get through this thing called life. That's all we can do. Peace out. I will be editing, doing more editing coming up once I get a job, I'm going to buy some better editing equipment, hopefully something better than just my phone, but actually have better video quality. And put a message down here at some point if anyone else has a channel I was wanting to do, if anyone ever wanted to do a collab. I know I'm not a big channel, and I'm not intending on, I don't really care about getting big. But if there's anyone else there who suffers with mental health disorders, has a channel or whatnot, or just wants to come on, sometime we could Zoom and we can put up, you know, talk it out. Because that's what it is at the end of the day. So yeah, just comment below whatever. I'll get back to all you. I love you all. Peace and love. Let's get after it. Let's have a good week.